So let's go ahead. Is that going to interrupt people if we go ahead so we can just get started, or is it? Well, good afternoon, everybody, and thanks again for coming to our press briefing. Originally, we were just hoping to give you an update on our single case here in Tulare County, but if you've all received the notice that was sent out this afternoon, we have received a second probable here in the county, and I apologize, Dr. Hott will be joining us momentarily. She's on the phone with officials from the State Health Department because our current situation has some little unique twist as it relates to the public health management. So I'm sure she'll be sharing more of that with you when she comes up. I do want to start with just a brief, well, first off, I once again want to let anybody here that's in the press corps to, if you want Spanish translation, we will have someone here that can basically provide you the exact same interview when we've concluded our remarks, and Yolanda would be happy to meet with you and provide that content. So briefly, some of the numbers questions. Our lab today has processed 133 specimens, and that we have also received in another 200 specimens. And so based on our lab director's participation in our DOC that we just recently concluded, we have reached that point where we're probably at or above capacity. So he will be developing some protocols to streamline or triage the number of specimens that are being brought into our lab. So it's been an extremely busy day. They're on 24-hour staffing in our laboratory just to keep the tests being processed. The state of California is now reporting 57 cases in both the probable and confirmed categories, with 16 cases in the confirmed category, 41 cases in the probable category. That 41 cases in the probable category does not count the second probable that we have here in Tulare County. So that's just a little bit of framing for the numbers. The other important variable that we heard this afternoon from the State Health Department is out of the 57 cases, both in the probable and confirmed status, we have 8 hospitalizations. We don't know exactly what that means, if it's persons that are acquiring the virus that are in that high-risk category of hospitalizations if they get influenza, or if it means that it's a more specifically virulent virus. But it is an interesting number, and we'll want to make sure that we track that level of acuity. I do want to, just before I see Dr. Hott is here now, before we get into her discussion of the additional case and the information around that and some of the other public health measures, I want to compliment again the clinics, the private medical community, and especially Sierra View District Hospital in their participation with the health department and management of information. It's been very, very exemplary in the communication that's been established very, very rapidly this afternoon when this information came in. And they have already emailed me an action plan that they have developed that was in place as part of their pandemic flu planning. And so I just want to once again commend all of our partners. It's not an effort that we undertake as a health department, but it's an effort that we undertake as a community. So my kudos go to those people that are showing that they were truly prepared, and all those exercises and planning events that we've conducted in the past are paying off. So with that, I'm going to bring Dr. Hott up, and she can talk to us briefly about the cases and the consequences.
Good afternoon, everybody. I guess it's already been mentioned that we do have another case of a young adult who has a probable case of the new H1N1 2009 swine influenza. So then that person has symptoms but is not seriously ill. So we are looking into all her contacts and trying to make sure we take care of those contacts appropriately. I also would like to express my appreciation for all the medical facilities that have been working with us, and Sierra View in this situation, and Delta and Tulare District and many others, and all the clinics that are and doctors' offices that are so busy. And I'd like to just mention to everybody that still we have no patients that are hospitalized here with this condition, and still for most people it's been mild, so I'd like people to be calm and not go to the ER, and try to just contact their providers if they have symptoms to discuss what their next steps are. And as far as the school that we talked about yesterday, the school is still closed because we need to close the school for 7 days from the last time that somebody had symptoms, but we don't have any other confirmed case or probable cases associated with that school, so that's really good.
Can you tell us anything else about the second probable case? How old the child is, if it's a boy or a girl, and you said Porterville area. I'm assuming that's not within the city limits?
Right, it's in the Porterville area. Yeah, it's a young adult.
You said it's a woman?
Yes, we
did.
Okay.
As far as the school is concerned, so if yesterday was the shutdown, does that mean the earliest you would be able to reopen it is on Wednesday?
It depends on some other testing results and what we clarify about symptoms.
Dr. Hott, are you investigating any other possible cases at Mountain View Elementary School?
I think there might be a few, one or two other tests that are pending, but that's,
One or two other tests that are pending in the county lab
right,
of Mountain View students?
right.
Would that affect the time that the school is actually opened back up?
Right.
It would? Okay,
Yes.
How so?
Well, it just depends on whether, it's a sort of a process of who was sick when and what was the last day they were in school, and putting it together with test results.
And how many other cases are you investigating there?
I think it's just one.
Just one?
Right.
Okay.
What about that second kindergartner you guys said was showing symptoms? I know those test results were supposed to come in today.
Those were not swine flu.
Okay.
Because that's what I was referring to, that the tests that we do have, we have two other tests from that school, they're not swine flu.
Oh, okay.
So
Sorry,
that's good.
I guess I'll clarify on following that up. So in addition to the kindergartner that we just talked about here, there are one or two other students that you're investigating at Mountain View.
What I was trying to say is two have already been tested and the results are in, and they're not swine flu. So there's still one test that's not, we don't have any results on yet.
So one test possible, two not swine flu.
I'm sorry, I didn't
One probable test and two that are not. As far as we understand, there is one probable case at this point, and you're saying there are two other tests that have come back negative.
Right,
Okay.
right.
And if it doesn't come back negative from the county lab, are you investigating anybody else
There's one other test pending.
at the county lab?
Right,
Okay, and that's not the person who was ruled out today?
right.
Okay.
Okay.
And that's from the school, Mountain View.
Right.
Okay. So 4 students in question total.
Right, that we know of right now, right.
And how is the first probable case, how is that student doing, you know?
It's getting better.
Can you say any more details about the Porterville case? Is it how old they are exactly?
No, I can't say how old they are exactly. We don't want to identify people individually.
You mentioned Sierra View District Hospital. Was there something in connection with the hospital on that case?
The patient was seen in the emergency room there. That's where the sample was taken and sent into our lab.
And when was that?
Tuesday night.
This person in the Porterville area, were they associated with a school or an employer or a group that other people have to be concerned about?
Yes, well, yes, they worked in a nursing facility, so we're working with that nursing facility to find out all the contacts and address that.
this young woman worked in a nursing facility?
Correct, right.
Okay.
And you are not releasing the name of that nursing facility at this time, or?
I think,
I think
yeah.
it's been generally discussed.
It's Porterville Convalescent Center.
Is that a concern for the health department? How would you characterize that?
Yes, it is a concern.
Okay.
Anytime there's influenza in a nursing home, even the normal circulating influenza, it's a concern. So this is equally or more a concern.
So are patients there being tested as well, or monitored? Or?
Well, they're being monitored, mm-hmm.
Sorry, it was Porterville Convalescent?
I think it's center, I think.
Center? Okay.
I think.
One physician told me, just as a personal opinion, that it seemed this flu was striking younger people, suggesting that perhaps older people have some immunity or inoculation or something. Have you had anything, any guess like that, or would you not kind of get you to speculate?
No, I don't know have that. I don't know that I have that information.
So at this point,
I think that some of the cases have been younger. I think there's probably a spectrum of ages, young and old, that have been infected. I think in Mexico there was a concern that it was younger people that seemed to be seriously ill.
so we had the one still probable case at Mountain View, but the possible case from yesterday has been ruled out.
Right.
But a couple other kids are being tested.
Right.
But would you call them possible cases, or just how would you?
I think when the official wording of the CDC is it's a suspect case if they're symptomatic and they're associated with a known case. So I guess that's the words we use.
So the one that was ruled out, just had the regular flu or something?
Right.
And so these others could just...
Right. We are still seeing around the community regular seasonal influenza. I mean, we're seeing that by our testing that we're doing, that we're still showing up some of the seasonal influenza, which makes it more complicated to tell just on a clinical basis.
As a physician, what do you think, when do you think we will have a better idea if this is something to continue being so excited about?
No.
I mean, it seems to be the symptoms are all mild and it doesn't seem to be any worse than the regular flu.
Right. Well, I can't give you a time frame. I think it'll just take time for us to have enough cases to know if it's the spectrum of illness is different than the seasonal influenza. So right now, I don't think there's enough cases for us to feel confident about that.
Just following on the school closure, the soonest that Mountain View will open up at this point, are you looking at Wednesday?
I can't say for sure. It depends on some of the test results, the last test result we get in.
The ones that are pending.
Right.
But the soonest, based on that 7-day threshold that was set up by the state, I understand, would be Wednesday. Is that correct?
No, because the child was out of school prior to when the school was closed. So.
Okay, so it's not.
It may be earlier than Wednesday, just depending on our test results.
Okay, so it's when that child is pulled out of school. That's when the threshold starts.
Well, when the last symptomatic child was in it, but if the child, if we confirm that the ones that were symptomatic are not this illness, then it's different.
Could you characterize how involved the school district has been in that decision as to when the school will be opened back up? We've had some administrators tell our paper that they don't feel that they've been very involved.
Well, I've tried to work very closely with the school district, and it is a health officer decision to close a school. I mean, it has to be done on the public health basis, but we've tried to work very closely with the schools.
Okay. Regarding the rise in specimens that the county is now dealing with, you are looking at 133 that you processed. I believe that's
I think it's 186 total as of this morning.
Excuse me. I was giving them some data from the DOC briefing. It was 133 that were processed yesterday and 200 specimens
Oh.
that were received today.
Oh, okay.
So processed yesterday were 133. It looks like we're getting an almost exponential rise in the number of specimens. I think it started out at 9 on Monday, then went to 37, and 133 yesterday, and now we're looking at 200. What would you attribute that rise to, and how is the county handling that?
Well, I think the rise is just because of the concern. I mean, it doesn't mean that we have a lot of spread of illness right now, because out of those specimens we've had 2 probable cases. So what it means is that there are people that have other illnesses, and because of this concern, we're testing a lot of people.
Okay. And then second, how is the county handling that? I'm asking essentially, it sounds like Director Bullock said that you have reached possibly or up to your capacity at the lab. You're working 24 hours a day there. Would you characterize how that work is going? Are you overwhelmed?
Well, we're working hard. I wouldn't say we're overwhelmed.
Okay.
You know, as things progress, with the guidelines for who gets tested will change. Once we know that there's more if we find the time that we know there's more infection, we won't necessarily need to test people. As the other seasonal influenza wanes, and if this influenza increases, then we'll not necessarily need to test people as much. We can just sort of assume that that's what it is.
Have you indeed reached your capacity there at the lab?
No. We have to prioritize specimens, but we have not reached our capacity.
You said now you're not handling all specimens that you get. Is that what I?
No, that's not what I meant. We have to, sometimes we have to put some ahead of the line if they're related to a decision about closing a school or whatever, that kind of thing. But
have you determined a number, a ceiling on which you can actually cover? If you're at 200 now, you're close to your close to sort of your maximum?
Jim, maybe I can just interrupt you.
Sure.
Because Dr. Hobb wasn't able to participate in the briefing with the lab director about an hour ago. And in that meeting, he had indicated that the 200 basically put them at capacity. Any further testing, they can't run more than that on any given day.
Okay.
They are acquiring some new kits, with put in some requisitions, so potentially that could change. But the time has come, in his opinion, to put together some triage recommendations to, as Dr. Hott just said, move things to the bottom. So whether it's not that we're not going to run those specimens, it may be that those specimens are put off until we get a slower day.
Okay. Is it also a possibility that you might be sending some of those other samples to another lab, say like a state lab? I know the other counties are actually not even handling some of their specimens.
that's because not other counties don't have the kind of lab we have. They don't have the ability to do that test. But I think the state lab is sort of has a large volume too. So we'll be sending them our specimens that need confirmation.
At that point, you'll just be doing the triaging to try and deal with that capacity.
Right.
Okay.
On the call this afternoon with the state, they are doing triaging themselves because they're at capacity. Actually, it's one of the things I'm very, very proud of is the fact that we are one of the few labs in the state that have the capability to do the influenza testing, and I believe, based on some relaxation of requirements as a result of this outbreak, our lab may be acquiring the capability to actually do the subtyping that currently is being required to be sent back to CDC or the state. So our lab has been extremely exemplary through this.
What is the turnaround time at this point if the Porterville patient had a specimen turned in around Tuesday and we got results back on that patient today? Are we looking at a 48-hour turnaround time from the county lab?
I don't know when that specimen was received in our lab, but our lab basically is that from the time the test is set up until they receive their results, it's approximately 4 hours. But I'm thinking we're going to get results in 24 hours once it gets received into the lab. So I don't know, even though the patient was seen Tuesday evening at Sierra View, when that was actually received into our lab, I don't know.
So 24-hour turnaround time, is that?
I think at this time, that's what I would be expecting.
Okay.
When will we know if the one probable is the flu?
Confirmed as this influenza of concern, the swine
Yeah,
influenza.
yeah.
Well, if it's sent up today, I would imagine it'd probably be over the weekend that they can confirm it.
I mean, the one from the Mountain View School, the school.
Oh, that one, they had told us at the end of the week, so which that means tomorrow, but
Tomorrow, okay.
I don't know if that's set in stone, but that's what.
And so this Porterville case could be confirmed as soon as this weekend.
Right. Mm-hmm.
How long do we have this emergency situation? I know the term is kind of.
Public health emergency. Well, it just depends on how things evolve.
But we're still in a public health emergency?
Right. Mm-hmm.
Following on that, Dr. Haddad, the arrival of supplies that were requested as a part of that declaration, talking about the 8,000 courses of Tamiflu and the 5,000 masks, did those come in? Have they arrived?
Yes.
When did they arrive?
Last night.
8/13, I think is when they were.
To a county warehouse? Is that
To county distribution.
okay? And those were from the state?
Yes.
Was it? Okay.
Mm-hmm.
And
And the masks were received today, and we've already had distribution requests, and plan has been put in place to distribute from our cash.
Where to, if I might ask?
We, as relates to the antivirals, we have a procedure in place to distribute to physicians who are requesting it. We're requesting up to 10 doses per physician.
And those were to be used for indigent patients, was it, low income?
The recommendations for low-income indigent patients that are otherwise unable to access antivirals through their private resources. And the masks are being, well, I know just recently there were some masks that were sent to CRD District Hospital. I think there's been other provider requests.
The Tamiflu arrived last night, the masks arrived this morning.
Correct.
And both those supplies are being handed out per requests from institutions
Through
or
our emergency preparedness office.
through OEM. Okay.
Well, EPO, Emergency Preparedness Office.
Okay. Director Bullock, you mentioned a unique twist that Dr. Hott was dealing with.
She mentioned it. The fact that this individual works in a convalescent facility clearly creates a situation where it's a heightened state of vigilance, because when you look at who at-risk individuals are for complications if they acquire flu, nursing home residents are one of those. So we just, it's unique in the sense that we want to make sure we're doing everything right and providing the correct advice to all parties. Okay, I thank you very, very much for coming in this afternoon, and we have not planned any media briefings at this point for tomorrow, but I'm sure Allison will be letting everybody know as the information rolls into our offices. So thank you.
Thank you.
Tracy, were you able to hear us?